The Director General of the Africa Centers for Disease Control and Prevention, Africa-CDC, Kaseya, has made a passionate plea to all African leaders who are engaged in the current DRC conflict to stop the war. He says that the healthcare sector is mostly affected, with infrastructure being destroyed, and this is a ticking time bomb, and this could lead to the outbreak of diseases. Speaking to International News editor Sophie Mokoena, Kaseya says this latest conflict has led to some patients being displaced, and this could lead to infectious diseases.
Currently, what's happening in the eastern part of DRC is not just affecting DRC, not affecting the region, it will affect the whole continent. Goma is a city of 3 million people. Out of the 3 million, you have 1 million who are displaced people coming from other places to Goma to seek for more security. With what is going on, let me share with you that we have mpox outbreak, measles outbreak, cholera outbreak in Goma. And for the mpox, we had around 158 people admitted to the center for treatment. Today, only 15 remain. It means we have more than 142 people with flu who decided to leave this place with their disease. They are where we don't know. They can contaminate other people, and we are expecting to have more cases. Don't forget that the mpox clade 1B started in this region. This mpox clade 1B is the reason why I have to declare mpox public health emergency of continental security. Killing children, young people, being sexually transmitted. And you can imagine, now you have more than 142 people out. We don't know where they are. They are contaminating others. And I think this is what is making me very worried.
Now, Director, the issue of infrastructure is quite critical. How will this affect the infrastructure also in terms of health services? Because the continent has been trying to rebuild infrastructure and strengthen our capacity based on our experience in relation to COVID-19. Is this a setback?
You are right saying that. Africa-CDC provided capacity to a number of countries. Let me remind you that before COVID, we had only 3 countries with the capacity to conduct genomic sequencing. Currently, we have around 27 countries in Africa, thanks to support that Africa-CDC provided. But in DRC, we provided support in Kinshasa and in Goma. This laboratory in Goma is keeping even pathogens that can be what we call high-risk pathogens. Then, in addition to that, Goma is known a region facing a lot of outbreaks, but without really having appropriate infrastructures. What we did is already destroyed with these wars and other issues that's happening there. This is why we say we are exposing the continent. Health personnel, they have to fly out of Goma. Infrastructures are destroyed. There is a risk that this laboratory with these pathogens that are there can be out, and we don't know who can use that for which purpose. And to finish, when you have a overcrowded camp, and when you have, you know, the density, the population density in Goma today is 39,600 people per square kilometer. It means the highest one in the world. When you take all of that together, it means we are sitting in an area that can be a bomb for the continent.
Have you been able, perhaps as Africa-CDC, perhaps through the African Union, to speak to the stakeholders, those who are affected and those who are part of this problem, in the region or in the eastern part of the DRC, be it Rwanda, Uganda, South Africa, Malawi, Tanzania, who are part of the troops, including the DRC government and the M23 rebels. Have you made all stakeholders aware of this time bomb?
I sent a letter through diplomatic channel to all head of state and government in Africa, all of them, including South Africa, Malawi, DRC, Rwanda, Burundi, all of them. I'm talking about the 55 head of states in Africa through the diplomatic channel. This letter was sent this weekend, on Saturday. And I was clear providing the information that is there. And I was saying to them, this issue is not just for security. It's a major public health issue that we are facing today. If you don't consider this issue as a public health issue, you are missing the boat. And in my letter, I clearly said, if bullets cannot kill us, outbreaks will kill us. And even I alerted that what is happening in Goma can even be the starting point for another pandemic from Africa that will affect all countries in the world. I made it clear to them. I think they took time to read my letter. I think they will act because we need to stop this unnecessary war that is affecting more than 5 million people, because now it's not just Goma, it's going to South Kivu, and that region is almost around 2 million people. I think this is my plea to our leaders to stop this war now. I sent it to official letter that I sent to them.
To Africans, what is your message? We tend to look at wars and conflicts in terms of security issue, but it is a health issue because the infrastructure gets damaged. What is your message to the Africans on the continent in relation to these conflicts? You are also aware that Sudan is also having a similar problem. Here in Cabo Delgado in the south, you have another tension there.
My message to our leaders is clear, simple. I say, while others, they are coming together to develop their continent, to develop their countries, we in Africa, we are wasting our time to fight against each other. We are destroying the small infrastructures that we have. We are killing the human resources that we have. How do you want us to lead the agenda of development? In addition to that, the current context where Western countries are decreasing assistance to Africa. We are aware of all decisions that some countries are making on daily basis. And that one, based on the information that we are having, if we compare 2023 to 2025, we'll have a decrease of almost $20 billion in terms of foreign assistance. It's time for us to wake up, to stop this war, but even to look for innovative mechanisms to provide more funding from African countries to Africa-CDC, to our own health systems, rather than fighting and killing people unnecessarily and stopping even the development of the continent. This is my message to them.
You spoke to the foreign funding. The President of the United States of America, Donald Trump, has made an announcement in terms of the intention to stop this aid to Africa, and health is going to be affected. How is CDC going to be affected and the continent? And also, what must be done?
Thank you. I had a meeting with President Ramaphosa in Davos regarding this situation. You know, 10 days ago, we were together in Davos for the World Economic Forum. And I had also to provide the information to all African head of state who were there. President Ramaphosa decided to take an initiative to talk and write to other head of state to engage them, to provide more funding. We are not talking about funding that must come from the national budget. We are talking about some innovative financing mechanism that can be applied. But more importantly, when I was informed about the US decision, on the 28th, I even have an interview with CNN. I sent some official communication using the channel that we have. And I was glad to know that the US, they considered our plea. They decided to provide a waiver for the life-saving humanitarian interventions, including HIV. But this is just the starting point. And I said to the US government that I'm available to fly to the US to meet the new administration to discuss on mutual interest what we need to do for the health sector in Africa that will protect also the US interests. I think this is where we are today. I think we are using the diplomatic channel to continue to talk, and I'm positive that our negotiation will improve the collaboration that we have with the US vis-a-vis African health systems.
Thank you so much, Director. Thank you so much. Let's hope that things will be fine.
We hope so, and we need first to start by cleaning our own house. Let us stop this unnecessary wars in Africa. Let us come together and build. Let us use the health sector as the entry point for the development. This is my key message to my leaders today.
Well, that was International News Editor Sophie Mokoena in conversation there with the Director General of the Africa Centers for Diseases.